Good evening. Today is Wednesday, July 22nd. Welcome to a special live Facebook update on the COVID-19 pandemic hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
Hi, and I'm Amy Collier-Carroll, Public Information Officer with Stanislaus County. We will both be moderating tonight's live update, which will be recorded and later posted to the Stan Emergency Facebook page and YouTube channel.
You won't see us on camera tonight, but you will hear our voices as we direct your questions to our panelists. And because so many questions were submitted in advance of today's broadcast, we will probably only have time to address those this week.
A couple of notes for the audience tonight. If we sound a little bit muffled, that's because Linda and I are both wearing masks. So we will try to carefully enunciate our words. And we also wanted to let you know that we're waiting on an interpreter, a sign language interpreter, to arrive from Elk Grove tonight. So we'll try to bring our sign language online as soon as possible. Stanislaus County Public Health Officer Dr. Wei Champayan is back this evening. She is joined by Stanislaus County Sheriff Jeff Dirkse, as well as our Chair of the Board of Supervisors, Kristin Olsen.
Let's begin tonight's discussion with Dr. V. It's been a while since we've hosted a forum like this. So question number one, can you please provide a snapshot of our current data in Stanislaus County?
Yeah, so as of today, we're reporting just under 7,000 cases. It's an increase of 149 today. We're reporting 4 more deaths today, and I'll talk a little bit more about that in a moment. And our total is now 77 that we've recorded. And we have just under 46,000 negative tests that we've recorded to date. To talk a little bit about deaths, some people have asked why they seem to come in groups. Like today we're reporting 4 after a couple days of 0. And there's a couple reasons for that. One is that deaths aren't required to be reported by law. So, not deaths due to communicable diseases, I should say. So when we get these death reports, they're voluntary, although they're given to us because we've requested them, but they don't always come in a timely manner. So when they become reported to us, which usually comes in some groups, then we look at them, we make sure they're a Stanislaus County resident, we make sure that they actually did, we review their medical records and make sure they did die of a COVID death, and then we report them out to the public. So when you see them coming out, that doesn't mean that all those deaths occurred today. These are just the ones that we've received, and we're now reporting out that we've confirmed these deaths. So I wanted everyone to know that. The other thing that I need to say this tonight is that you're going to see an increase in recovered today. And as you know, we changed the way we were reporting cases in our data a week or two ago to account for a large increase. And one of the things we've had to do is change the way we actually report our recovered data too. So there were a couple days when we weren't able to really update these numbers, and so I think we're going up by around 1,000 today, and that's just catching up with our data reporting. So I hope you go to the website and you look at our numbers.
Thank you, Dr. V. We'll stick with you for just a moment. While our COVID-19 numbers have increased, we don't seem to see as many deaths. Do we know why death percentages are not rising as quickly as illness?
So we see about 1% of our reported diagnosed COVID cases do actually die. And we know that we don't actually diagnose all the COVID that's circulating in our community and infecting people, right? So there have been estimates, CDC just put out somewhere between 2 and 20 cases for every one that gets diagnosed. And so we know we have a lot more disease. So it's really hard to calculate a rate based on that disease that's diagnosed to have it be anywhere close to accurate. That being said, in addition to that, we also know that what we're seeing now with the spread is in people who are younger. And we know that people who are younger, a different proportion of them, a lower proportion of them will die. And so there's a difference between an outbreak in people who are 65 and older, which we know have a higher rate of death, versus an outbreak in people, say, under 50. And so we would expect to see fewer deaths with the way we're seeing infections being spread right now.
Thank you, Dr. V. We have a lot of questions for you tonight, so we'll get back to you here shortly. I wanted to go to Sheriff Dirkse. We had a question on enforcement on Facebook this week. The question is, I don't understand why the big cities are enforcing wearing a mask and Stanislaus County is not. Are we waiting for the hospitals to be full to follow the order, or what are we waiting for? Is this something that your team has discussed?
Yeah, so there are many, many misnomers about enforcement. And so let me start with a couple of things. First of all, as the law is written, the violation of the order is a misdemeanor. It is a misdemeanor just like drunk driving, possession of heroin, possession of meth, misdemeanor domestic violence. It's all the same charge. And for law enforcement, the only enforcement action for law enforcement is to make an arrest. Now, for a misdemeanor, we can't issue a citation, but it is still an arrest. An arrest goes on someone's permanent record. And so every law enforcement agency in this county has pretty much said we are not going to arrest people out and about who are not wearing masks or who are not social distancing. And I think that's the right thing to do when you look at this. Now, let me caveat that. That doesn't mean that you should not wear a mask when you're out and about. It doesn't mean that you should have a party or a gathering. There is nothing about that that says you should do those things. You absolutely should not. But we are not going to become the mask police. Now, when it comes to enforcement, there are a lot of other enforcement mechanisms that are out there. And our particular target are the businesses that are specifically expected to follow certain guidelines, whether it's to close, do things outdoors, provide the proper engineering protocols or PPE or whatnot, social distance spacing for their staff. Those we are enforcing, but we're doing that through education. So you can email businesses that you do not feel are doing the right thing, and we follow up with them. We take that information, and this hasn't changed since March 19th. We take that information, we give it to the appropriate jurisdiction, whether that's in the county or in one of the cities, and those jurisdictions follow up with that business. And the vast majority of those businesses with a contact from someone from that jurisdiction, whether it's a city worker, a county worker, they comply. They do whatever it is that they are supposed to do. Whether it's close or modify how they're doing business, they do that. And so if that's what you want to call enforcement, we absolutely do that. As a law enforcement officer, that is not enforcement to me, that is education. Now, we did have a business recently that, quite frankly, I thought we were probably going to end up going in there and arresting the business. I think he was a manager, actually. This particular business had 200 employees. 33 of those employees were positive, so over 15% of employees. It was an outbreak. And this business was blatantly not following any of the rules. We issued very specific orders to that business on how they could stay open. They failed to do that, so we issued a very specific order to them that they must close, and they could not reopen until they met certain protocols. And he was given about 15 hours to comply, and if not, then he would have gone to jail. And thankfully, he complied. And so that business is open. They are doing the right thing. They are protecting their employees now, and by default, they are protecting our community. So let's be clear, we're not going to be stopping people on the street for not wearing a mask or having too many people too close together and arresting them. But that doesn't mean that we are not doing educational actions. And if there is a blatant violation like what I just spoke to, then we will take the appropriate measures.
Thank you, Sheriff. Let's go next to Supervisor Olsen. The number of coronavirus cases has leveled off, or did level off in early April, but then in May, Governor Newsom reversed course and allowed many counties to open back up, including Stanislaus, which had requested a variance. In retrospect, do you believe the county reopened too soon?
It's a great question. No, I actually don't believe the county opened too soon. At that time, we actually met all of the criteria that the state put out and required for an attestation. We had very low numbers. We had done a really good job as a county slowing spread and making sure that we had the resources in place to take care of the situation at that time and future. The problem really wasn't the opening of those businesses at that time. The problem was so many people in Stanislaus County went back and acted as if life was normal again. And we saw people in large gatherings having backyard barbecues, and that was not a good situation. And so now now we see we've had significant spread, significant community transmission because people were not following the safety protocols that they were supposed to follow even under the attestation, documentation, and variants that we were given. There's a really interesting tool that's been developed, and I believe that it will be up on the Facebook screen. It's a long URL, but it's the COVID-19 Event Risk Assessment Tool. And if you go there, you can look at each individual county, not just in California, but across the nation, and see, based on the level of spread in that county at this time, what is my risk for attending an event at a various size. You can look up a 10-person event, a 25-person event, a 100-person event. And it's a really good planning tool for people to realize the risk that they're exposing themselves to if they go to these events. I'll give you one example. Because our numbers and transmission is so high in Stanislaus County right now, this risk assessment tool shows that an event of just 25 people in Stanislaus County right now carries a 74% risk level for at least one person getting exposed. So these are real numbers, and again, it wasn't the fact that we began to open businesses, it was the fact that people didn't modify their behavior and they were acting as if COVID was no longer here. So again, at the end of the day, it's up to each of us as individuals to take personal responsibility for how we can each change our own behaviors, wearing masks when we're out in public, practicing social distancing, limiting our mixing outside of households. And together, if we're each practicing those safe behaviors, we will begin to slow spread in our community.
There was a second component of that question, too. The second part of the question is, what is the county doing now to ensure that the rate of spread and our number of active cases goes down?
So there's not much more the county can do. We've provided guidance to individuals across the county. We've provided guidance to businesses. Our EOC is active day in, day out, 7 days a week. We are available for people and businesses with questions on what are the guidelines that they need to follow. We're tracking our hospital numbers, working collaboratively with hospitals. But at the end of the day, as I just said a minute ago, it's up to each person individually to change their behavior if we're going to be successful in slowing spread, reducing our hospital numbers, and being able to open things back up. So again, the best thing that the county can be doing is reminding people, wear your face coverings, practice social distancing, limit the amount of times you're out in public. You know, one thing I often recommend to people, instead of going to the store every day, consolidate your shopping, go once a week, right? And that's a very practical way that people can begin to limit their exposure to the general public.
Thank you, Supervisor Olsen. Let's go to Dr. V again. So many questions for you on the status of COVID-19 in our community. How are our local hospitals doing right now in the way of staffing, PPE, and ICU bed capacity?
So our hospitals are starting to feel the strain of having a lot of COVID-19 spreading in our community. And so they are dealing with getting more staff and more PPE. And so all of our hospitals have plans. They've had plans. Sometimes in a flu season, we exercise. We have to open up these surge plans. So hospitals have surge plans that they have in place to be able to respond to increases in census in the hospitals. So they work their plans. So if they can't have enough staff or enough PPE, they go through their regular suppliers. They have ways that they get staff. They have staffing agencies that they usually use. They have places where they get their PPE, their personal protective equipment. So if those they cannot find anymore, they're parts of systems, they're parts of Sutter, they're parts of Tenet and Kaiser. And so they work through their system and they get these resources from other hospitals who maybe aren't seeing this increase in patients in their hospital. And so they bring in staff, they bring in supplies, and they're able to do that. If those resources are all used up, then they start working through the government. So they come to the county and they ask for resources, and we look, and if we can't supply them, then they go to our region. And if the region can't supply it, it goes to the state, and then it goes to the federal government. And so we haven't gotten to those places yet, between working with their usual suppliers to increase staff and PPE and working through their systems. They have mostly been able to meet this need. And they are starting to get close, because one of the things that's happening is that while we're seeing a lot of spread of the community, that also includes healthcare workers. And so there is increased absenteeism and illness in healthcare workers. And so not only is the need increased, but the staffing availability decreased somewhat. So we're working through all these systems. They're not all dried up, so we're still working through them. For ICU beds, our ICU beds are getting full, as I think you've seen from our website. Hospitals, again, have plans in place to expand ICU beds and ICU capacity. So we're still working through our plans. That's basically the update for our hospitals.
Dr. V, we'll stick with you for just a moment. I wanted to ask this question that came from Facebook this week. We understand that we are in the top 2 counties on the state's watch list. What does this mean, and what is the technical support that the state is said to be providing that will help us get our numbers under control?
So we've been working with the state. Each week we have a meeting for about an hour with them where we discuss what we're seeing and we discuss what needs we have. So through these meetings, we've gotten some resources, like we've gotten people to help us with data entry, because data entry always is a huge, huge task. We collect a lot of data, and getting people to enter it into systems so that it can be analyzed and inform our actions is always something that takes quite a bit of time. In addition, contact tracing staff are available from the state, and we have 20 of those working with us right now. And so these are actions that have come about from our, what we call, technical assistance calls.
Let's go to Sheriff Dirkse for a moment. We've talked a little bit about cluster outbreaks tonight, and we know that some of the inmates in jails around the state have come down with positive COVID-19 results. How is our jail right now, and have we seen any outbreaks in the jail population? And then secondly, what is being done to protect inmates and jail staff?
Yeah, so we have done quite well in relation to COVID in terms of the inmates in our care. At the moment, to date, we have had 2 inmates who have tested positive for COVID-19. So we don't have any kind of an outbreak or any kind of a cluster. One of those individuals was released from state prison, COVID positive, and delivered to our county, where he was put up at taxpayer expense in a hotel, which was provided for him so he could quarantine for the remainder of his COVID time. And we placed him on a GPS monitor. Our probation department did that, and within about 12 hours he violated his quarantine. He went to a taco truck and a liquor store and was promptly rearrested and booked and placed into our jail, COVID positive. So he is one of those 2. And then we do have another COVID positive inmate who was arrested COVID positive. His family was exposed, and that's where he got it from. So to date, there is no kind of transmission within our facility. And I'm very proud of my team there and what they have done. We have implemented many, many measures to protect both our staff and the inmates in our care. So, for example, anyone who enters any of our custodial facilities is screened before they ever set foot in there. That includes my staff, that includes any inmates who are coming into our care, that includes any other arresting officers from other agencies when they come to book them. Everyone is pre-screened. Anyone who displays particular symptoms or they fail the screen, so to speak, they are booked through a whole separate booking area, and they are housed separately, quarantined basically. And then the other thing that we do is that all inmates who are booked, say today, July 22nd, everyone booked today is housed together for the first 14 days that they're in custody. That way, if they were asymptomatic and something does, they do become infected, then they are at least, that spread would be mitigated and contained to those that they are housed with. We have purchased many different types of stronger, better cleaning materials. One are, I refer to them as the robots. We actually call them CV-19 in kind of a Star Wars-esque naming convention, if you will. And these are towers that we put into various cells or any room, and they use ultraviolet laser light, and they kill any bacteria that's in the room. They've been very effective and very helpful. And we have another of other just protocols that occur throughout our facility for the inmates. And we do the same with our staff. As you can see, everyone has been issued some sort of a face covering. Obviously, when you see a deputy driving around in a car by himself, he's probably not going to have it on. But anytime that there's a contact, when it's necessary and needed, then obviously the expectation is that they wear them, and they know that. And I have never received a specific complaint on that. Yeah, I've had generalities about it, but I've never received a complaint that our staff is doing that. We have locked down certain portions of our building. It's already a secure building, but even now, like for staff, they are strongly discouraged, say, from going into certain portions of the office. Call, send an email, whatnot, but limiting that person-to-person exposure. And obviously, COVID is in our community, and everyone can see the spread. I do have 10 staff members who have tested positive. Some have already recovered from it. Some are out, and I have another 10 that are out at the moment due to an exposure. They're not necessarily positive. They might not ever be, but they are off duty for that. And like every other business out there right now, obviously that creates a bit of a staffing impact on us, but we are well resourced right now, and we have more than enough staff that's out there to serve our community.
Thank you, Sheriff. Let's go over to Supervisor Olsen. Kristin, Stanislaus County has been on a state watch list. How do you foresee us getting off the watch list when so much is closed in our county and yet our numbers continue to grow?
This is a difficult question, and before I address it, I actually want to go back to the last question about what can the county do, what is the county doing to help slow the spread. There were two additional things I did want to mention, and we'll talk about them more later in the Facebook Live, but that's contact tracing and testing. Both of those two elements remain absolutely critical components to slowing the spread of COVID-19 in our county, and the county actively works on both those issues every day. We have a robust contact tracing team up and running. I know other counties have had challenges with that. It's challenging for everyone, particularly as case numbers continue to grow, but contact tracing is a key component that the county is actively working on. And then with testing, seeing what we can do by bringing in additional lab resources or modifying lab resources in order to expedite the turnaround of test results. That, as everybody knows, has been a challenge, particularly over the last 2 or 3 weeks. So those are just two additional measures that the county is working on to partner with the community in slowing spread. But again, I want to underscore it takes personal responsibility as well. And that leads into the question you just asked. What is it going to take for us to get off the state monitoring list? And sadly, unfortunately, I don't have a great answer. It's frustrating and depressing even to myself, but I truly don't see us getting off that state monitoring list until and unless people in Stanislaus County, all of us, begin to change behaviors more significantly. We have to reduce our mixing outside of households. We have to stop the large gatherings. We hear on almost a daily basis about people gathering in groups of 200, 300 people even. And as I talked about earlier, even smaller gatherings of 25, 50, 75 people are contributing to significant spread and increasing our numbers and beginning to overwhelm our hospitals. So it really does come down to personal responsibility and practicing those behaviors that collectively can work to reduce spread and get us off that state monitoring list so that we can open businesses again, so that we can open our schools.
Let's go to Dr. V for a moment, because Supervisor Olsen brought up contact tracing, and we do have some questions that have come in from our Facebook community about contact tracing. I know that our team is really struggling to keep up with the caseload, and we understand that other counties are too. As a matter of fact, Merced County stopped altogether because their COVID-19 numbers were too high to trace. What support or resources do counties need, and do we need specifically, to be able to stay on top of this process?
Yeah, that's a really difficult question, because when you're getting a lot of cases in, it's almost impossible to keep up. So a lot of people use that word contact tracing to mean the whole process. And I have to tell you that contact tracing is a small part of the process. It's a necessary part of the process. I shouldn't say it's small, but what has to come first, it's the second part of a process, I should say. What has to come first is that when we get a report of a person who has tested positive, we have to call that person. We can't do any contact tracing until we've called that person and found out where they've been, where they work, where they could have possibly exposed people. And that right there is actually, I would say, the bulk of the work, is trying to find out where the exposures could possibly have happened. Then once we get places, then it's quite a bit easier to start contact tracing and doing that part. So really, I would say where we need probably the most help from the state is really in that investigation piece, contacting the people, trying to determine where they've been, and then trying to then get names and then do the contact tracing.
Dr. V, since we're on the subject of contact tracing, we know that some people do not want to cooperate when they are called by public health. Can you tell us why contact tracing is so important and how it keeps the community safe?
So, yes, I can. As we work through this process, what we're trying to do is stop spread. Stop spread from one individual to the next. And that on a community level means slowing down spread, because you can't stop all of it, but we try to stop it on an individual level. So what we want to do is find the people who've been in contacts, because they're the next cases. And so they're the ones that we want to make sure they stay in a quarantine, and so that they don't further the spread. And so that's why it's so important to do, is to get them to stop the spread with them.
Thank you, Dr. V. One more question on this topic. This came in from one of our Facebook viewers earlier this week in regards to contact tracing. And the question is, do you leave a message if no one answers? And will the call indicate it's coming from the county because this person doesn't answer numbers that they're not familiar with?
Yeah, so this was a great question. So I've actually looked into this, and it's not quite the straightforward answer. So first of all, yes, they do leave a message saying they're from public health. So that's the easy part of the question. The caller ID part is a little bit more difficult, because we have a whole bunch of different systems. So if you are the person who has tested positive, we are usually calling you from a public health phone number. And it turns out that our public health phone, while we're trying to get this changed, does not have caller ID, and that it displays. So everybody, if it's a 209-558 number, that is public health. So all I can say is that's a public health number. We start with 558. So those would be a good one to answer. For the contact tracing, we are calling through the state system, that CalConnect system that they've gotten up. It automatically calls people's phone numbers that are in the system. So that depends on your carrier, believe it or not. And so they have a caller ID that says CA COVID team. And so hopefully that will show up on your phone. If it's with a carrier that does not carry that, because I'm told this is a vanity caller ID, which, I don't really understand caller ID, but there you have it. It will just show up as a Sacramento number. So it's a 916 number that it will come through as. So my best advice is, if you get either a 209-558, some 4 last digit number, or you get a Sacramento number, it would be very helpful if you answered your phone, and so that we can contact you for this.
Dr. V, I'm just going to ask you one follow-up question. If anyone is suspicious of where the phone call comes from, what should they do in that case?
They can ask for a number and call it back.
Okay.
They've been doing that.
Okay, so thank you. I'm going to skip over Sheriff Dirkse, but I'll get back to you, I promise. Kristin, I wanted to ask you this question that came in on Facebook. Since 73% of COVID-19 patients are Latino, there's concern that messaging isn't reaching this demographic. What is the county doing to ensure thorough outreach?
Yes, this is an important question, because as we've heard from many people, and as anybody can go to the Stan Emergency dashboard and see, the Latino community in our county and across the state is being impacted in larger disproportionate numbers. And so we recognize how important it is to make sure that we have effective outreach programs in place to reach those populations in particular. And so there's a few different things we've done. One, the Stan Emergency website is available in Spanish as well as many other languages. All of the documents that we produce are available in both English and Spanish. We are working with various community-based organizations across the county. Some of them include the Latino Emergency Council, El Concilio, and others that are in those neighborhoods with those communities and can reach them more effectively than, say, someone in a county office could. Also, we have Erica Ignacio on our team, on our county team, who does a fantastic job reaching out to these different MACs and community-based organizations to make sure they're receiving the information that they need and in their native languages. Just on Monday, she held a meeting actually with a number of these CBOs to talk about getting out into the communities with information on how to reduce spread, how to protect themselves, how to access resources for small businesses that need assistance. So we've been doing a lot. And then the last thing I would mention is we have a lot of radio PSAs out on Spanish radio, knowing that that's a popular venue for people to listen to. We're always open to ideas on how we can do better, but we have a lot of things going on both in English and Spanish to make sure that we're reaching all the populations we need to throughout the county.
Thank you, Supervisor Olsen. And I'll add that we have the Stan Emergency Espanol Facebook page. So those of you at home who want to check out the content on there, it mirrors what's on the Stan Emergency Facebook page. I have another question for you while we've got your attention here. You mentioned business support, and we know that recently our Board of Supervisors approved a new business grant program. Can you tell us a little bit about who is eligible for this funding and how business owners can apply?
Yes, we're excited to be able to roll out a second phase of assisting businesses across Stanislaus County. As people will remember, early on in this coronavirus situation, in March or April, we rolled out $3 million worth of mini grants, micro grants to small businesses, and we were pleased to be able to assist almost 400 small businesses across the county with that funding. Now we're coming back for a second round thanks to the CARES funding that we've received from the feds, and we have $15 million to allocate. So we're taking $10 million of that and setting it aside for eligible businesses. We're currently putting the final touches on the application process. That application will go live on stanworkforce.com by July 31st. And after that date, it will be provided both in English and Spanish. And then after that date, eligible businesses, which has a variety of criteria that will be easily spelled out, but they'll have about 4 weeks to submit their applications. We're also working with CBOs, community-based organizations, chambers of commerce, El Concilio, NAACP, and others to make sure that they have all the information to reach out to their networks and make sure that people in all communities have information about how to apply for this business assistance. And then once we receive those applications, they'll be scored based on various criteria, the number one driver being how deep was the impact that you faced because of COVID-19 orders. So we're excited to be able to roll that out. In addition to the $10 million, we have $4 million set aside that will be allocated to nonprofits, eligible nonprofits in our community. And then the final $1 million will go for a touchless gift card program. I think this is going to be a really creative way to help both retailers across the county, but also consumers. And the basic example of how it's going to work, and again, some of the technology quirks are still getting refined, but if I purchase a gift card for a business in Houston, say, for $10, that money is matched with CARES Act funds as well as private philanthropist funds, and it's a $20 gift card that then I can use in that business. So the business receives $20 from me, I only had to spend $10. So again, we want to make sure that this program is available to communities across the county to help both individuals whose discretionary spending income is likely less than it once was, as well as to the small businesses in our community. And I just want to remind people, by July 31st, they can go to stanworkforce.com and they'll find the application for these funds available in both English and Spanish.
Thank you, Kristin. We'll go to Sheriff Dirkse. Sheriff, how are crime stats trending lately? Is this public health crisis having any impact on the types of crimes that we're seeing?
Yeah, so many of our crimes are up. They have been up for a while. I think last time I was on here, we spoke about like general assaults. They're up. A lot of the family crimes are up, and now that's slightly different than just domestic violence. They could be many different family-related crimes. It could be, a father-son fight, which doesn't really qualify as domestic violence in and of itself. But their family crimes, they're up because tensions are there. Auto theft is up dramatically. Because there's a lot of folks out there with nothing to do and they're out stealing cars. Calls to the suicide hotline are up. While suicides themselves are not statistically, and attempt suicides are running about equal, calls to the suicide prevention hotline are way up, which clearly indicates that there is a mental health concern out there. One crime that is down, although we don't believe it's actually down, there's a dramatic drop in reports of child molestation or child abuse. One of the reasons for that is most of those crimes are actually reported at schools. That kid is out of the house and they feel safe there and they can make that report there. So the reporting on that has dropped, and I'm going to guarantee that the crime is not down. It's just the ability of that victim to report it. Because the corollary is there is an extreme spike in child pornography reports. So that tells me that we have a lot of problems out there, but we aren't getting the child victims. They don't have the opportunity to report it, and so obviously that is a concern. And obviously with schools staying closed, that is something that we're going to have to figure out. How do we get those victims? How do they have an opportunity to safely report that crime? And so that is an item of discussion with law enforcement.
Thank you, Sheriff. Let's continue the discussion about schools, actually, and we'll go to Dr. V for this. Last week, Governor Newsom announced that no schools can open this fall, holding in-person classes in counties on the watch list. Our local districts, school districts, are struggling to accommodate this, but are confident there will be a plan in place for next month to start a new school year. Do you foresee schools opening later this fall, or do you think it will be early 2021 before students can actually go back into classrooms?
Yeah, that's a really hard question because none of us can predict the future. What I can say is that we are all working very hard. Our first priority is getting children in school, absolutely. What it's going to take is we have to get our disease spread down. We need to make it so that kids can go to school and not be more exposed than they are at home. So we need to really work on that as a community. So to get our kids back in school, really, it's really those messages we keep saying. Stay at least 6 feet away. You have to keep that physical distance away from people. This is spread by droplets that come out of the mouth. And so in general, if you're 6 feet away, those droplets don't reach you. If you wear a face covering, and everybody wears a face covering, that keeps those droplets from spreading. And then you got to wash your hands frequently and often so you're not taking the virus from some surface and putting it in your eyes, nose, or mouth, as we talked about so many times before. So it's really up to us as a community to take all the actions that we need to take to slow down the spread in our community and get it down to a level where our kids can get back in school, because that is what we need to have happen.
Dr. V, there's a follow-up question on Facebook. If children and teens have proven to have a lower rate of illness, why are we closing the schools?
So there's a couple things about that. So first of all, kids aren't the only people in the schools, so we have to think about all level of people in the schools. Second of all, kids have families that they go home to that may be multi-generational. So it's not just their parents, but there may be grandparents and other at-risk people in the household. So unfortunately, when we're sending children out to spread to mix, they can become infected, and while the children may do very well, it's not going to help our community to have them bringing COVID-19 home to their families and having it spread in households, which we know is probably the highest risk place to have it spread is in the households. Teens, we don't really have a good understanding yet. I think it's pretty clear that children under the age of 10 seem to be less likely to get infected. and seem to be less likely to spread. That doesn't mean no, that means less likely. So there's a decreased chance. So children under 10, which is why we're talking about like a waiver for elementary school, and I know all of us want to get our kids back in elementary school for so many reasons. Distance learning is so hard for those smaller children, and we know they're a bit less risk. As soon as our disease spread starts going down in this county to a level of which we think it's less risk to get them back in school, they will be the first children that we are hoping to get back in school. Above 10, above 12, they're acting a little bit more like adults, and a recent study just came out of South Korea in the last week that looks like maybe teens aren't at any less risk than adults. Certainly, we know that the risk for severe disease increases with increasing age. So they are less likely to have severe disease, for sure, than the 20s, than the 30s, than the 40s, because every year you go up, the risk increases to have severe disease. But we're not sure that they're actually less likely to become infected and less likely to spread in those teen years. And so that's something that is still being looked at. I can't answer that for sure. Another problem with schools, as we talk about with high schools, it's a little easier again with elementary schools because they kind of stay in one class for the most part. We can keep them in these stable cohorts, as we call them. When they go to high school, that doesn't happen. They change classes all day long. They're in the halls. They're passing each other. There's a lot of mixing that's going on, and that's going to really increase the chance of exposure and spread. So high schools and those upper ages are going to be more difficult to get back in the classrooms. It doesn't mean impossible. We got to get our spread down lower for those upper grades.
Thank you, Dr. V. I want to remind everyone who's watching from home, there's been so much great information shared tonight so far. Please go back and watch from the beginning if you have tuned in late. It'll be up on our Facebook page and also our YouTube channel, and you'll get some great information there. Let's go to Supervisor Olsen. We're talking about schools. As a parent, I'm sure you share many parents' concerns about student success in this next school year. What are your thoughts on how we can keep our kids on track academically in the coming year?
As Dr. V said, this is a really difficult question. It literally keeps me up at night thinking about what parents and students are going to do across our county without our schools being open. I have 3 kids. One's going to be a freshman in college, one a junior in high school, and one a 7th grader, and really wrestling with what are we going to do. And then my heart really goes out to those families who don't have an option of working from home. And, are we going to have young kids at home by themselves? There's just so many questions that keep me up at night as we all try to figure out what are we going to do to keep kids safe, and as your question asked, to keep kids learning. And the good news I've been participating in a lot of the Modesto City Schools live events, for example, and I know a lot of districts around the county are having these, and they are committed to doing a better job than they were able to do last spring when it comes to distance learning. Last spring, this was just sprung upon all of us. Everybody was just trying to do the best they could, given a really difficult situation. That continues to be the case. All the schools and the school districts are trying to do the best they can to develop the most robust distance learning programs for our kids, and I am confident that they are committed to making it a better experience than it was before. We have yet to see what that's going to look like. A couple of suggestions I have for parents that I'm exploring. Last spring I mentioned a lot about the Khan Academy online resources that can provide additional assistance. Another idea that was shared with me recently are student teachers. So a lot of students who are in the last year of their credential and would normally getting their student teaching experience in a classroom aren't able to do that right now, and may be available to assist parents who are trying to help their kids learn. Especially at these high school levels, some of these subject matters are really difficult. And so that's one idea, is to reach out to people who might be going through a teacher credentialing program, reaching out to friends who are teachers or experts in various subject matters, and trying to just come together and help each other get through this difficult time and make sure that our kids continue to progress academically. But as Dr. V said, our number one priority has to be getting the schools back open. I could talk about this for hours, but we all have to be committed to reducing our numbers and getting those schools open again.
Thank you, Kristin. We're going to go to Sheriff Dirkse. A moment ago, you addressed trending crimes. Sheriff, what is your biggest concern for our community from a law enforcement point of view right now?
Well, let me start with a couple things. First, there is absolutely nothing about COVID-19 that makes anyone happy. It doesn't matter where you fall on an ideological standpoint or anything else, nothing about this makes anybody happy. Second, I think everyone has to understand that there is absolutely no way for us to stop COVID-19. It does not exist. Our goal is to slow the spread so that we have adequate hospital capacity so that we can treat those who require hospitalization, slow the spread so that we can reopen our schools, which is obviously the single biggest goal that we want to get out of this. We can get our kids back in there. So with that, my single biggest concern as the sheriff, it's not even really specifically to law enforcement, it's fatigue. It is COVID fatigue. People are getting tired of watching us on Facebook Live. They're getting tired of reading about it on Fox or CNN or Facebook or whatever media source they have. It is so all-pervasive. That is why we are seeing calls to the suicide prevention hotline go up. We need to get this done, and my fear is that we have fatigue. And what everyone needs to do is stay the course. You need to wear your mask when you're out and about and when you can't social distance. You need to not have parties, gatherings, workplace events, whatever the case may be. We can't do that. That is where the spread comes from. If you are an employer, you need to do what you need to do to protect your employees so that they don't get it and they don't take it home and spread it. So, yes, this is going to be here for a while. I have said now for several months that I think that we will be in a state of emergency until July 1st of next year. I've said that here on Facebook Live before. And we have to realize this is going to be here for a while. We have to realize that this is our normal for the foreseeable future. We have to stay the course, and we have to get this thing slowed down so that we can have adequate hospital space and get our kids back in school. So fatigue is my single biggest concern, not just from a law enforcement standpoint, because crimes are going up as a result of it, but because I think people are simply getting tired of dealing with it.
Well, we've now hit the 45-minute mark into this broadcast, so that's a good point to end. And for our audience that may be hearing impaired, we wanted to apologize. One of our interpreters did get caught up in traffic tonight. So wanted to encourage you to go to the YouTube broadcast because that's a great place to get the closed captioning on tonight's video that will be posted soon after this broadcast ends. So we want to thank you to all of our panelists for being here tonight and providing the community with an important update on the COVID-19 pandemic and guidance to help keep our families safe.
And thank you at home for sending in your questions. If we didn't get to your question tonight, we'll continue to answer them in the social media updates throughout the next week.
And as a reminder, you can find us on Facebook, YouTube, Twitter, and Instagram. Just search for the keywords Stan Emergency.
Thanks again, everyone. Stay safe, healthy, and informed. Good night.